So another important aspect of our biosecurity program is active surveillance. What I mean by active surveillance is environmental cultures like Chris is doing right here, making sure this stall is clean of salmonella, because that's what we worry about in our hospital. And at the same time, we do active surveillance on our patients here. Depending on your patient biosecurity level, determines how many fecal cultures we do to our patients while they're here being treated medically. And we look for salmonella, as again, it's one of the most common hospital-acquired infections in our area. So what Chris is going to do, I'm going to take this from Chris, we're going to get it to the lab, and we're going to show you what we do with this biosecurity sample in our laboratory. So again, it's all part of active surveillance, which is very important when it comes to hospital biosecurity. So now that we have the environmental sample from one of our stalls in the barn, we're going to take it to the laboratory where Tina can end up processing it to something that's useful. Tina, I'm sorry I'm a little late. Will you be able to process this today?
Yes, I can get it worked out. I get it logged into our computer system so it can produce labels that have barcodes and accession numbers that will be unique to this sample throughout the culture process.
And that's one of the great things, Tina, is having this barcode system on here, because it reduces any sort of errors that can happen, and we can track it and log it into the computer that if I have any questions about environmental sampling, you can quickly access your data.
Yes, we can generate reports for the doctor of any positive or negative samples or environmental patient samples, depending on what his needs are for the day. So he can track and monitor results.
And that's the enrichment broth you're putting in right now, right?
Once we have it labeled, we will add the enrichment broth, and after it's in the enrichment broth, we incubate it overnight, and then we will transfer some of the specimen to our selected broths for salmonella, which enhances the growth of salmonella and inhibits the growth of other organisms. After incubation of the broths, we will then transfer some of the samples to our selected plates for salmonella, which also enhances the growth of salmonella and inhibits the growth of other organisms. And it also helps differentiate salmonella from other organisms. On the plate, the salmonella will produce black or clear colonies, whereas other organisms can produce yellow, or some can produce some black colonies that are similar to salmonella. And at this point, whenever we see the suspicious colonies on the plates, we are going to perform our rapid diagnostic test, the reveal from Neogen. If the reveal is positive, we then will follow our protocol that has been established by our infectious disease officer and notify the infectious disease coordinator, who can take proper protocol to protect our patients, our employees, and our facility. We will then further confirm the ID with other identification methods and perform a sensitivity. And then this information will be given to our infectious disease officer, who will utilize this information to track and monitor any infectious diseases.
Now with these nanobiogram reports that Tina is currently producing for us, I can utilize this information on our patient to determine, did it come in with salmonella or could it have potentially acquired it at our hospital? So with this information, we can determine if any sort of biosecurity procedures need to be implemented to help protect that patient as well as our hospital for potential infectious diseases.